Hey everyone, welcome back to my channel and welcome to another vlog. Today I am here with a health update. It's a very, just going over some things. Very simple video. So, as you can see on my channel, if you scroll down a few videos, you can see that there's a total of 4 Oncology Infusion vlogs. And, this has been a weird but tough, let's just put it in that, like a tough journey. So I'm gonna explain what the Oncology Infusions were for. This is basically a, explaining, Retuximab, or explaining the Oncology Infusions video. But yeah, I'm just gonna briefly go over all the stuff that I've done, like what happens in a weekly infusion day. So I had low platelets. I have so I'm gonna go in order. I'll insert the full description from my own medical chart on here at 140. So yeah, you can pause to read if you want, and all this information will be in the description box below, but I'm gonna read over everything. So Oncology Infusions, the diagnosis was Evans syndrome and ITP, which is immune thrombocytopenia, I think. The pre-meds were Solu-Medrol, and then I took BENADRYL 25 mg capsule, acetaminophen 325 mg tablet, which is also known as TYLENOL. The infusion was Retuximab. It was once a week, and it was 4 infusions total. And those infusions usually were from 9 a.m. to 3:30, something like that. So the notes that I'm including, that should pop up right in this area at 2:55. Okay, so pause to read again. This is my explanation of it. It can go a lot more into some very different details, way more detailed. But from what I know, it's not chemotherapy, first of all. So if anyone has that question, answered it. It can cause hair loss. Personally, I haven't experienced hair loss with Retux. Okay, so it can cause hair loss in certain areas such as armpits, or, your temples, eyebrows, etc., whatever. Those are some of the things from a, simple Google search that a lot of people can find. Now, the side effects of Retux are fever, chills, body aches, rashes, jet lag, headaches, and a bunch of other stuff. The timeline for Retuximab is a little challenging. It's weird. So results can vary from 6 to 12 weeks depending on immune system of the individual. Now, for me, I got to my last CBC, according to July 31st at 12:30, was 63,000 for platelets. Now, that's still, not the best. It should be a little more, but it's okay for the 4th week. Going back to the 6 to 12 week timeline, it's hard to say. So from what I know and what I've been told by my attending physician, by the way, an attending is someone who's done with residency and who's did all their fellowships and, you know, all that. If you want a video on all my doctors, I would love to make one another day. So my last CBC was 63,000. The timeline is 6 to 12 weeks. My CBC was at 4 weeks. So by the time that I hit the 12-week mark, it should be 120, 125, something like that, hopefully. Now, with what I have, these counts can go up and down at any time. I remember there was this one specific point in time, it was 28th June, where I went in, and that day was supposed to be hematology clearance, and, you know, that was for the cath lab for a cardiac catheterization. I could not get cleared because my platelets went from 116,000 to 11,000 in like 2 weeks, which was bad. So, previous history, moving on. I have done, you know, 3 infusions of IVIG, which is intravenous, it's intravenous immunoglobulin. And I'm also an orthopedic and cardiology patient, as well as hematology. That's a topic for a whole another day. It's a whole another crap show, but I'll go over it. Cardiology is for the cath lab, which is cardiac catheterization, and I have to do, like, you know, once a year I have to do an EKG and echo, and then an echocardiogram. I've had a, you know, endoscopic echocardiogram. I'm thinking of the other word. It's something, I don't remember. But that's what I've had when they were supposed to do the catheterization. So I've gone in 2 times for the catheterization. One time it just didn't work because my platelets were too low, and then the other time I went in to get cleared, and then I found out that they would try to give me medication to be able to pull off the surgery. Couldn't do that either because they weren't up to the correct numbers. Then today I found out some unfortunate stuff. This video is probably going to be uploaded at the end of August, so I'll probably have an update by then, hopefully. But I found out that I'm not going to be able to do my orthopedic surgery, and that's for a distal femoral reconstruction with osteotomy, which basically means osteotomy is basically where they cut the bones at, like, they cut that specific bone or whatever bone that you're having work on. They cut it at like specific angles or like at a specific type of cut, and that or like, you know, whatever, cutting the bone, like that technique basically is what osteotomy is. And then, you know, distal is the middle part of your femur, which is the femoral part of the word, which is a distal femoral reconstruction. Reconstruction is basically where they're going to take out a triangle out of my knee. I will do an explanation video. I have to do a bunch of appointments for that, which is pre-op. I was hoping to do it in October, but there's some other family issues. I'm still not sure. I'm very disappointed that I, you know, don't have a date yet, but I'm really, really hoping to get it done within the next 6 months. That's just the plan for now, and I'll be going back on September 4th for the hematology clearance and a follow-up, and if everything is good and if the platelets are above 100,000, I'll be able to do at least my cardiac catheterization, which is good enough. It's not all my goals for the year, and this is something that I was looking forward to for the past 5 years. I've been planning this leg surgery, but, you know, it is what it is. again, I enjoyed making this video. It was a nice thing to do, and it was nice to talk to you guys. I hope you have a great day, and I'll see you in another video.